thank you very much for being here at the time. And may we shall start now our session. And we welcome Professor Kouskoukis, who is a professor of dermatology, is a lawyer, is the president of the Hellenic Academy of Thermal Medicine and president of World Academy of Chinese and Complementary Medicine. And he's going to speak about thermal therapy. Professor Kouskoukis, the floor is yours. Thank you.
Hello. Good morning, everybody. As far as I see, so beautiful ladies. In this sunny day outside, it's very good combination to be more emotional and to be more happy. First of all, I want to congratulate Ms. Spiropoulou. Antonopoulou Kati. Katerina in Greek. Anyway, thank you very much, President, for the invitation. And it's a good opportunity to say you some more things about what is going here in Greece, and especially for the people who are suffering from Sjögren's disease. And I think it's worthwhile to mention that right now we have legislation here in Greece that the thermal medicine is a complementary medicine, and this is by the law in Greece, and this works since 6 months. I think that you are very familiar with all this. Okay. So, complementary therapies, I'm referring to this. And of course, I don't mention any more about the Sjögren's disease because you know this is a syndrome. Of course, it's an immune disease, just like psoriasis and so many other, which are very, have an excellent correlation, a very heavy connection with the food, because some of them are inflammatory diseases, and the good food is very good for them. And you know. Okay, and except this, you have to know that Greek food, not Mediterranean food, Greek food is an excellent combination for the people that have all these advantages. I don't mention again about this because you know so many other colleagues refer to this, but it's very important for me as a professor of dermatology for dry eyes and dry mouth, but exceptionally for the musculoskeletal systems. And you see that rheumatoid arthritis, lupus, of course. So this syndrome, it's really a syndrome with so many phases. So it's very important to recognize in the early stages in order to face it the best way. Otherwise, it's very difficult. And it's very difficult to diagnose early because the symptoms are very peculiar. And people going from one doctor to the other, and I have in my mind to say everywhere that the patient is the center of all the doctors' field and specialties. Usually one doctor says, no, this is dermatological, another says rheumatoid disease, and so no. It's very important that on this disease we have to focus, all of us, all the complicated these specialties, dry eyes and dry mouth. Of course, they have all this, they have skin rashes on the dry skin. Again, because we are also venereologists, dryness in the vagina, and so prolonged fatigue. People, so many have this syndrome. Of course, it's an autoimmune disease, and have a look. So many parts are complicated: joints, thyroid, kidneys, liver, lungs, skin, nerves, and all are these risks. And of course, it's for men and women. The complications are really very heavy. So So many times we have dental cavities, the lymph nodes, vision problems, which many people start with, and they cannot focus on this. Lungs, yeast infections. So many people, they have yeast in their mouth, especially in the tongue. It's very important. And all these have also implications and complications from the nerves. We have this academy, which is the Hellenic Academy of Thermal Medicine, and you see healing in Greece. This is very representative for us because we believe in this special climate. All around there are thermal springs, but we have also the special climate, and we have to do this. And the thermal medicine refers to prevention, retention, treatment, and healthy recovery with all the modern methods or natural methods. This is the Thermal Medicine Academy, is the natural methods combining rest, relaxation, and fun. The basic idea is the mental, emotional, and spiritual regeneration. Relaxed in a relaxed environment. And go straight to my presentation because you have to know that thermal springs means that they have some special elements, just like sulfur and hydrogen sulfide, who are very, very active for the disease, they say. You see, the sulfur has cermicide, antifungal, parasiticide, anti-allergic, anti-toxic, healing, epithelialization, desquamation, anti-inflammatory, and immunosuppression, especially for Sjögren syndrome. All of this, that's why we present these therapies with natural methods, because they have results, and whatever I say, it is evidence-based medicine. There is a great literature all over the world, and we're trying to do the best for us. For example, you see that the hydrogen sulfide it's up to the pH of the skin of the air. It's different, maybe gas or maybe salt. On the other slide, you see that it goes in the it's absorbed through the skin, or if it's gas, through the lungs, and goes in the circulation, and when it goes to the circulation, goes straight to the cells, they go inside and make all these chemical reactions, and at the last, you see, they have also regeneration, and we have also new vessels, which is very important for all the diseases. Why? Please help. Nobody? Okay, at the last. You see, at this slide, you see that sulfur makes epithelialization and desquamation. It works both ways. That's why in psoriasis, for example, since you are the general secretary of your organization, it works this way. We have very deep lesions in psoriasis, and it makes desquamation. And since it makes the desquamation, then comes the reepithelialization. So there is a balance. And it's very important that natural things can do this. And the other one says, again, how they work in different pH and different temperature. And you see, again, in which way it works with the nitric oxide, and two of them in combination through different enzymes in the nucleus, they make the reepithelialization and make new vessels generation. And the mechanisms are mechanical actions. For example, if you go in the water, the thermal water, there is a hydrostatic pressure, and except this is the rise, two main factors. You see, thermal actions is very important for all the musculoskeletal, because they relax, and when they relax, all the ligaments and so on leave a space and give a sense of well-being. chemical actions, as I referred before, biological, and of course immune actions. These are the mechanisms that the natural waters or gases work. Thermalism, it's of course a wide range of prevention with therapeutic applications using natural resources in different areas. But it's very important here in Greece because we have this climate. I had to tell it because it's not to say again about Greece, but as far as I know, if you go, for example, to another country that has not the seaside or this climate, different. Because it's very important in the atmosphere that they have to be anions who give a very good sensation and very good mood. And of course, thermalism does not regard only to the elderly, the baby boomers famous, but it's a new concept that we right now say it's for all the ages, and it's a new lifestyle, and especially in this childhood where we make some special washes for the heirs. Of course, thermalism includes all the activities and all the environmental parameters in order to prevent, maintain, and restore physical and mental health and wellness. Right now, wellness, but here in Greece, we don't discuss anymore about wellness. We are discussing about well-being. This is the Greek, evzin, well-being. Well-being means to be more older and, of course, to be very, very healthy. It's an important role of water, also in cosmetics and dermatology and products and spa. We are from different countries. You have, of course, you have spas in your countries, but we already discussed right now about medical spa, medi-spa. Different way, because medical spa, many, we can use all these natural sources, but under medical supervision and under medical approval. That's why I mentioned this is evidence-based medicine. It's very important. And of course, all the pharmacies, the drugs works, but additionally, complementary, we can do this. And the complementary treatment, it's up to the doctor. Who doctor has to be alert and has to know about this. Otherwise, of course, something goes somewhere else. And another is the thalassotherapy. Of course, if you are from countries that they are surrounding pharmacy, you have this. Here in Greece, we have a very good thalassotherapy centers. And which are the forms of thermalism? Which way can we do this and to use these natural sources? The one is the hydrotherapy. We use the water, the thermal water. Even external, which is the balneotherapy, or internal, which means washes, oral, nasal, or gynecological. Here is, for example, Sjögren syndrome, oral, nasal, and gynecological. Drinking therapy, inhalation therapy, bath therapy, which is very, very important for the myosqueletic and the most important for psoriasis, but for myosqueletic it's excellent. Thalassotherapy, the biochlomatotherapy, and the cave salt therapy. It's in Poland. Who is coming from Poland? No one. You have some caves there which are very, very therapeutic. And this is the basic therapeutic elements. I don't want to mention one by one. You can read. And of course, you can take my presentation, Mr. President, Mrs. President Antonopoulou, you can give to all of them. And if you have any question, the mobile phone is available through, right, Mr. President, and then of course, we organize some more special lessons. You see, there are inorganic elements and non-metals, microminerals, and noble gases. From all of this, the most important is I'll show you is the sulfur and the radonium. You see all the affected diseases. When I'm saying I'm a musculoskeletal system, there are so many diseases. Respiratory, cardiovascular, nervous, endocrine, gastrointestinal, urinary, dermatological, gynecological, allergic, ENT, and periodontal. Periodontal, it's very important because all this affects the skin, the mucous membrane, and the endothelium. Endothelium is the inner of the veins, of the arteries and so on. And right now we're running a protocol to see which is more resultful. Is the sulfur or the phenols from the red wine? It's very important. And the current trend globally is this, and there's all this that I mentioned, they are not referred only to patients, but also to healthy people. And this is the preventive medicine, which is very important. And Professor Filippo will say you some more about how we can make different preventive exercise in order to feel younger and to have programs for rejuvenation and relaxation. And another concept that we're doing right now in Greece is the meditation, not medication, the meditation. You know, yoga, qigong, and so on, because I'm also the president of the Chinese medicine and complementary medicine, and I work on this. You have to know this and to make the combination. Every person, it's a different world. So you have to find out all this. And of course, it's a key lifestyle. It's a new concept to work on this. The last today speaker, Ms. Kalaji, will say about the new lifestyle. It's a new concept. We have to follow. We have to understand what is going on, and we have to follow it. We have, of course, to give to ourselves more time for tourism and travel, because we give very good results from visiting in different parts, of course, and it's up to the how do you have to do this. It's not you have to take the plane to go to Brazil. First of all, check around your country, your continent. And of course, you know, COVID gave us a great experience how we have to, not to waste our time, but we have to do the best for ourselves. The life expectancy, you know, it's more than 100 years. You know this? Do you know what is the blue zones? Blue zones is a new concept that works around. It's 5 places all over the world that people live more than 100 years. Example is Ikaria in Greece, Sardinia in Italy, Okinawa in Japan, and 2 states in USA. These are the blue zones where the people live more than 100. And some of you will say, unbelievable. No, of course, believe. And when I mentioned to the doctors before 10 years, they told no, it was not so good. Today, we hear everyone that he died 90, 95, 100, 105, and so on. And of course, there are the exceptions. Still 126. Do you know the French lady? Of course, that she died in this age. So we have to face this with smile, and we have to get older with the best condition emotionally, and of course we have to be in a good health. So since we have this extension, You know about the silver tourism, 55 plus. Did you ever hear about this? Minnesota till 55. Before 5 years, we say that the limit is till 82, which the mean between men and women. And what about later? So we call the golden age from 82 to 100. And in the last World Congress who have in Kamena Vurla, we mention the platinum age, which is more than 100, because all these ages have to be covered. And it's very important because the older people, it's not just only retired. No, there is not retired for me. These people are a think tank. And you are younger, you have to think and do tank, not only think tank, think and do tank. This is for you. For the others is think tank. You see, there are so many European medispacs with strong medical background, so all the people suffering from Sjögren syndrome, they can go there and have an excellent manipulation, and we have good result with traditional spa treatments, which are known for many years. And of course, these people will be very, very satisfied. Services of thermalism is this spa rehabilitation, and of course refers to primary prevention, to secondary prevention, and to the more than 80 years prevention. The advantages of thermalism is a new concept throughout all the year. It's very important. And all these units, you can go there, and it's very important to keep in mind that every therapy is under medical supervision, first. Second, it's only 21 applications per 6 months, not more, and only for 20 minutes. It's very important. If it's more, there are, of course, contraindications, and you have to follow the protocols. The development in Greece potentials are excellent because we have excellent doctors, we have good staff, and this is the meaning of the spa and the thermal medicine. This is from ancient times, of course, and you see this, so you have to know this. And of course, mud therapy. We have mud therapy in Greece, but of course, in so many countries there are mud therapy. People are going in the mud, and the mud is the excellent therapy for Sjögrens, for the myoskeletals, and for the skin, and for the lupus, and so on. So, if you have, this is our academy, and if you have any questions right now, or later on, you can call me. Thank you.
Thank you, Professor Kourkoukis. Do we have any 1 or 2 questions because she has to leave? No? Okay.
I'll be waiting for your call.
Okay, thank you. Now we're going to present Professor Philippou is going to present a lecture about pacing. Professor Philippou is a professor of, associate professor of experimental physiology, exercise physiology, School of Medicine, National and Kapodistrian University of Athens. Professor Philippou.
Thank you, Mrs. Chair, for the kind introduction. Dear participants in this very interesting conference, I would like to thank you all for being here in this last session of the conference. And of course, please allow me to thank the organizing committee and especially Mrs. Antonopoulou, the president of the Sjögren Europe board, for the very kind invitation. In continuance of the very special and interesting information that was shared in this room during this conference, I would like to start my presentation by just reminding you that in this systemic autoimmune disease. Up to 40% of the patients present with systemic manifestations, and most of them report pain and fatigue, among other clinical symptoms like depressive and sleep disorders. All this, as you clearly understand, result in decreased quality of life. And what these people suffering from chronic pain usually do is to get into a cycle of doing too much on the days that the pain levels are lower, and doing on the days, the bad days, less activity or no activity. So this vicious cycle of over and under activity, as you can see in, yep, thank you. As you can see on the right side of this slide, results eventually in longer periods of rest and smaller periods of physical activity, along with lower levels of physical activity. In order to break this vicious cycle, the pain cycle, what these people should do, these patients, your patients should do, is to actually adopt the active rest cycle, or in other words, the activity pacing, which means that these people should, when feel pain, should rest and should alternate periods of physical activity and pain depending on their symptoms. So, in other words, pacing is not about stopping or decreasing the physical activity levels, but it's actually a synchronization, a tuning of their daily living activities by following, let me say, these three simple steps. They should make a list of some of the things that they try to overdo, and then make a time limit, determine a time limit for these activities, and then stop and rest before the pain levels increase to be uncomfortable and so decreasing their activity levels and so their daily quality of life. I'm sorry, I'm trying to move on the next slide by the way that we usually do. So forgive me for that. So we are on the same page now. And please remember, allow me to very shortly remind you some steps that you can find in forms of activity pacing. There are, as you may know better than me, many forms of making activity pacing. And these 5 simple steps, as you can see here, is to suggest the patients, the Sjögren's patients, to choose activities that try to increase the pain and their fatigue. And after that, decide how many minutes of activity and how many minutes of rest they will spend on each of these 2 parts of their day. Later on, record the week's starting goal, and after that, subsequently, record the activity rest schedule that they can actually follow and use during the day. Eventually, this will result in an hopefully, in an overall assessment with whether this choice was resulted in activity levels that were better, increased, lower, or the same. And just as a daily or a weekly goal, we could suggest an activity and a rest cycle, an activity pacing cycle, 3 per day or 21 per week. And now I would like to move to the other very important syndrome, clinical symptom of this syndrome, fatigue, which, as you know, it is identified by the patients as the most important one and the one that most difficult to cope with. So because of the multidimensional nature of fatigue, as I will show you in the next slide, we should, both the clinicians and all the therapists and all the people that are involved in the treatment of these patients should suggest the effective management of the Sjögren's associated fatigue by adopting a patient-centric and a multidisciplinary approach. I will refer to the role of physical activity in continuance of the previous mentions regarding the effect of physical activity, the optimal physical activity on the symptoms of pain. And now I will move into the role of physical activity in order to cope with fatigue in patients, in Sjögren's patients. As you can see here, there are at least 13 different types of fatigue, and I'm sure that you are familiar with these different types as are exhibited in your patients. The important thing that I would like to mention a little bit more is that a recent study by my colleague, I think he's participating in this congress, NG, Professor NG. He's co-author of this recent research that mentions that activity interference in patients with Sjögren's syndrome. And as you can see, the results of this study revealed that fatigue, dear colleagues and Fred, was the biggest, had the biggest impact on 7 activity domains, as you can see, that deal with not only the physical exercise impairments and barriers, also performing household chores, gardening or shopping, socializing, doing recreational or hobbies activities, and of course sexual relationships and mental efficacy. So I would like now to very shortly move back to the possibly first research conducted regarding the effect of physical activity and systemic regular exercise on the clinical symptoms and the functional capacity of patients with primary Sjögren's syndrome. And this study, back 15 years ago, started the hypothesis that based on emerging evidence that exercise training can improve physical capacity, muscle function, and several other clinical symptoms such as fatigue and pain I mentioned before for our patients, and also based on the evidence that exercise training, regular exercise, may have anti-inflammatory effect based on studies in low-grade systemic inflammation chronic diseases like the Sjögren's syndrome has also these characteristics. And so based on this hypothesis, they conducted this initial research, the findings of which can be seen here. The exercise protocol included actually Nordic walking for 45 minutes, and in purpose mention some details of these protocols as also for the ones that I will mention later on, because the exercise characteristics in terms of intensity, duration, type, and time are organizing an exercise protocol so as to be optimal and individualized for each of your patients. So the first evidence for the effectiveness of exercise, physical activity, regular physical activity or exercise, as in this research, was that improvements were revealed about the fatigue, aerobic capacity, depression, and overall physical function. Later on, 5 years ago, we can, here we can see also the details I mentioned before about the importance of setting specific goals regarding the characteristics of exercise, the intensity that the patients should follow in order to be effective and not harmful, but beneficial instead of that. And you can see that the intensity can go up to 80% of the maximal heart rate. This is for those that the scientists that in the audience that are not so familiar with the way that we can calculate the maximal heart rate. A simple way is to subtract from the number 220 the age of the patient, so you can estimate the maximal heart rate of each one of you, depending on your age, and based on this maximal expected estimated maximal heart rate, you can determine the level of the intensity level of the exercise program, so as this exercise program to be effective and at the same time safe. As you can see, again, in this very interesting study, the improvements that achieved were in aerobic capacity, exercise tolerance, patient's perception of improvement. This is a very important issue. And also fatigue without exacerbation of disease. And here you can see, in terms of graphs, the significant effects of the supervised walking aerobic exercise on exercise tolerance, fatigue, and cardiorespiratory fitness. Going to the last part, the last few slides of my presentation, I would like to mention some things of this also interesting study regarding the guided exercise programs that actually can help patients to overcome fatigue, maintain their flexibility, and overcome joint and muscle pain. So here you can see some useful conclusions. I selected some of them that, in my opinion, reveal the today's evidence regarding the utilization of physical activity and exercise in patients with Sjögren syndrome. As you can see, various non-pharmaceutical therapy interventions can be adopted depending on the patient's needs and preference, like occupational therapy, physiotherapy, or health psychology. A lot of this information was exchanged in this room in the previous talks. So I would like, very interestingly, to mention that regardless the potential that all these alternative treatments may have, the evidence-based information that we can share each other regarding the utilization of exercise at the moment, dear friends, ladies and gentlemen, it's that aerobic exercise seems to be safe, effective, and the only published non-pharmaceutical intervention that appears to be effective in an overall approach for utilization in the Sjögren's syndrome. So going to my last or two slides of my presentation, I would like at this point, dear colleagues and friends, to introduce the proposal Exercise is Medicine, which is a global movement and vision regarding the utilization of physical activity to fight the non-communicable diseases as Sjögren disease is also, by using physical exercise. And the aim of this global movement is to incorporate physical exercise into health systems, and the clinicians, the physicians, the doctors that have the responsibility to treat the Sjögren's syndrome patients, to refer their patients to, based on specific evidence, in specialized, personalized, as I mentioned before, exercise programs that certainly in our days are documented for their benefits. And there are guidelines for various chronic diseases and autoimmune diseases regarding the utilization of exercise as part of the therapeutic approach in clinical practice. So now I would like to ask Aris, please help me with starting the 90 seconds video that includes all these messages to take home regarding the benefits of exercise after incorporating it into the way of thinking of the physician and clinician regarding the treatment approaches that may have for her patients.
Meet Jane. Jane's a hardworking individual with a chronic health condition. Jane wants to get healthier, but it seems like there's always another obstacle to overcome. What if we gave Jane a support system and made exercise as routine as taking her daily prescriptions? The solution? Exercise is medicine. EIM brings together patients, physicians, and exercise professionals. It creates trust, establishes accountability, and produces positive health outcomes. Here's how it works. Jane visits her doctor for a checkup. Before EIM, Jane's doctor may have simply advised her to exercise more often. Now, with additional resources and a stronger support system, Jane's doctor can write a prescription for exercise and refer her to an EIM-credentialed exercise professional. Jane's exercise professional works with her to provide the structure, routine, and motivation she needs to achieve her health goals. When Jane visits her doctor again, her chronic condition has improved. This means a happier doctor, a healthier Jane, and a positive, lasting impact on her quality of life. Not only could EIM help Jane, it could help millions of people who have a chronic disease, an epidemic that accounts for 86% of our healthcare spending. Exercise is medicine, lowers costs for healthcare systems and patients, while also providing important resources for physicians and exercise professionals. A compelling solution for a healthier world. Ready to get involved? Here's how.
I would like to thank you all for your presence here and also for your attention. And I would like to call you to go back 25 centuries ago to the words of the father of the modern medicine, Hippocrates, that maybe it's a way that in our days should again adopted by utilizing exercise among other therapeutic approaches in order to find the right and the safe way for health. Thank you very much for your attention.
Thank you very much, Professor Philippou. Do we have any questions? Yes. Can you give the microphone, please, Manos?
And just a reminder about what you said about the 13 types of fatigue. It was Sjögren Europe campaign 2 years ago, and we did a leaflet with the 15, we said 15 types of fatigue translated and so on. So it can be helpful for your patients, it can be helpful for your colleagues to go back to this campaign, and it's easily explained every type of fatigue. Thank you, Professor.
Yeah. Thank you. Excellent presentation, and I think activity pacing is one of the most powerful, together with exercise, treatments for fatigue across different diseases. I just wanted to add to that there's a lot of tools on the internet that are available, very good tools that actually help you with the activity pacing, that has some education about it, some information, and some worksheets that you can actually use to help you with the activity pacing, and that may be useful for some of your organizations. I believe Professor Sjögren from Utrecht University has written a book, also a small leaflet that is available on treating fatigue, and I think it's on the Sjögren Europe website, and I believe pacing is in there, but some other activities. So thanks. Yeah.
Thank you for mentioning that. Thank you. Yep. I
Yes,
totally agree.
thank you, Linda. Thank you.
May I have a question? You said your doctor describes. So you means that, or prescribes, because in many, many countries like ours, the doctor cannot prescribe, they just propose.
Yeah, yeah. Thank you for this very important question. Indeed, at least in our country, here in Greece, the doctors refer, and I think this is the main way that the clinicians and physicians can be cooperate with the other providers, health providers, in multidisciplinary approach. So the doctor is the person that assess and refer her patient to people that are qualified, have the credentials to apply to prescribe the specific characteristics of exercise, and this close collaboration, interdisciplinary collaboration, is the key of success. So let me say the take-home message. I would say the clinician, physician refers the patient to specific other scientists that can prescribe the specific characteristics of the exercise programs.
Do we have any other question? Okay, thank you very much, Professor Philippou. And now we're going to come Mrs. Kalliopi Kaladzi, who is going to speak about lifestyle medicine. And Mrs. Kaladzi is a physical medicine and rehabilitation doctor, a lifestyle medicine and culinary coach, head of lifestyle medicine department at Euroclinic Hospital Athens. She's also an academic scholar at Attikon Hospital, Athens Medical School. Thank you.
Thank you, Mrs. Antonopoulou, for the introduction. And I'm really happy to participate in that conference because it's always important for us, the physicians, to listen to our patients. This is very, very important. And we should always take into considerations when we are consulting, when we are prescribing, the needs, the real needs of our patients, and not only the guidelines. So I don't know if anybody here knows something about lifestyle medicine. Have you heard about lifestyle medicine before? No. Okay, not yet. Okay. So I have no conflict of interest, but I'm, okay, as Mrs. Antonopoulou said, we have here in Athens a lifestyle medicine department in Euroclinic. So most of you, after the diagnosis, you had a question, like all patients with a chronic condition. Is there anything that I can do for my condition? Because part of our treatment depends on our actions. And I'm always reminding, when I talk to colleagues, when I talk to the public, when I talk to patients, what is health? What we aim to restore with medicine and with our behavior. So, according to World Health Organization, health is not merely the absence of disease or infirmity, but a state of complete physical, mental, and social well-being. So, You are diagnosed with Sjögren. Is there anything that you can do for your health? I'm sure that you are better doctors for your conditions than many of us are, because you know your body and you know how you react to your everyday life and everyday habits. So, yes, there is a powerful tool, and this is optimizing my lifestyle. How to make these lifestyle changes? Always follow evidence-based things that you can do. There are no magic solutions. Consult with your doctor. Follow a rehabilitation program if you have a available one in your country. Here in Greece, we don't have any rehabilitation program for people with Sjögren. But I worked in Germany, and there are some better solutions for patients with chronic conditions. So, if you cannot find a rehabilitation program, seek out for a lifestyle medicine physician. Maybe there is somebody in your city, around your village. So, and what to expect as a patient? So, lifestyle medicine is not alternative medicine, is not functional medicine, is not complementary medicine, is not integrative medicine, is not mind-body medicine. Although, some things in functional medicine or in complementary medicine or in mind-body medicine could work. I don't say that they cannot work, but this is not lifestyle medicine. Yeah.
Yeah, because it's white.
Okay. Sorry. Here. So, I'm telling you, don't worry.
Anything for that, guys?
So, what is lifestyle medicine? This is also white. I didn't know, but lifestyle could be a medicine, and this is known from the ancient times. Everybody knows Hippocrates. Professor Philippou also introduced us to Hippocrates. So, Hippocrates was talking actually about lifestyle medicine because he was dividing medicine in three branches: internal medicine, surgery, and dietetics. But when we say diet, we say dieta in Greek is also a way of life, not only the ingredients that what we eat. And we know that our lifestyle choices are responsible for the vast majority of chronic diseases. The World Health Organization admits that 80% of all chronic conditions could be preventable through lifestyle modifications. But in modern medicine, both lifestyle medicine and environment are ignored. So evidence-based is what we call allopathetic medicine, what we learn in the medical schools, what our professors like Professor Philippou teach us in our medical school. So it is evidence-based. It's the part of the guidelines that is mostly ignored. The first part in every guideline for every disease, for every condition, for every syndrome has a part that has to do with lifestyle modifications. But we never focus on that part. So, what does lifestyle medicine? It aims to maintain optimal health. It aims to prevent, treat, and reverse chronic illness in some conditions, not in your condition, not yet. And the health intervention used include evidence-based behavioral strategies. So it goes beyond consultation alone. And these behavioral strategies are helpful for optimizing nutrition, for sleep hygiene, for stress management, for making better social connections and healthy and supportive relationship, physical activity, and minimizing substance use, and not only substance use, but minimizing all the harmful behaviors that we have. So, and there are 6 pillars of lifestyle medicine, as I told you before, and this could be healthy eating, mental well-being, restorative sleep, healthy relationships, minimizing harmful substances, and behaviors and physical activity. There is a lot of question if this is a new medical specialty. In some countries, like in the United States or in Great Britain, there is a subspecialty, let's say, because a physician could be board certified in lifestyle medicine. And why we need a new specialty? Because we have a lot of specialties. Because if you see here, okay, you can see it a little bit, only 10% of our risk to die prematurely depends on healthcare systems. But all of the question and all of the money go just to that 10%. Although 40% of our health outcomes are dependent on our individual behavior. And lifestyle could be a powerful tool for our lifespan. So this is pioneering research from the US population. And what does it say? The people that were following these 5 things, so they were... Sorry, but can you guess a little bit further? Okay. Okay, so the people that had a normal BMI, had never smoked, were consuming just a little bit of alcohol, were doing 30 minutes of physical activity every day, and they were following healthy dietary patterns. When they were 50, the women had 43.1 more years to live. In comparison, the people that had 0 out of 5 factors, they would live only 29 years more. And this research didn't see if the patients had a disease or not. So our lifestyle is a powerful tool for extending our lifespan. But what happens with our health span, with the years that we live without disease or without infirmity? So this is another research from the European countries. So this is the EPIC research, and they were seeking for these 4 factors: never smoking, having a body mass index lower than 30, that means also overweight, performing 3.5 hours every week or more of physical activity, and adhering to a healthy dietary principles. These people that were following these 4 ways in their lifestyle, they were an overall 80%, 78% lower risk of developing a chronic disease. They had 93% lower risk of developing diabetes, 21% lower risk of developing myocardial infarction, and so on and so on. So our lifestyle, we know, that could extend our lifespan and our health span. So this is why we need a new medical specialty that focuses on lifestyle as medicine. So let's talk a little bit about healthy eating. I'm sure that most of you, and otherwise you wouldn't be here in a conference about your disease. So that means that you are looking for solutions, and probably you are following a healthy diet. But let's talk more about Mediterranean diet, because we know, and according to research, Mediterranean diet is one of the best diets in the world for every kind of disease. But I want just to point that this is not only the fiber or the whole grain bread. I want you to take into consideration the lower thing there that shows how we eat this Mediterranean diet. Because this includes a Mediterranean lifestyle. So we cook at home. We don't use ultra-processed food. We buy locally the food that we are consuming. And we enjoy food around the table with our friends. So food is not our joy, it accompanies our joy. This is the Mediterranean lifestyle, and this is one element of the Mediterranean diet that makes it very powerful. And of course, we know that the Mediterranean diet has a mainly anti-inflammatory mechanism, and this is important for all the inflammatory diseases and syndromes like yours. But I won't go thoroughly in all these things. I just want to show you that. And also, there is a lot of evidence that a plant-based diet rich in fruits, vegetables, lean protein, and low in processed foods helps reduce inflammation common in Sjögren patients, thereby alleviating symptoms. Because Professor Philippou gave a perfect speech, I won't go deep in physical activity, but you know that physical activity it's not only going to the gym. You can just take the stairs, walk to your work, do what you have to do for your house. And yes, in some countries there is an exercise prescription, but I would say, Professor Philippou, that we can prescribe in Greece also, but the insurance companies won't pay for it. We prescribe as physicians some other things that are not paid by the system. That doesn't mean that we cannot prescribe. So what we should do is that we should educate ourselves better, like you did with the Greek Society for Physical Medicine and Rehabilitation Physicians. So we were very lucky to go through a program and be ready to prescribe exercise for our patients. With exercise is medicine, I mean. So now you can, because we changed it, it was from Mac to Microsoft, and it's not perfect, but I will tell you what's written. You know that stress could be a trigger for autoimmune diseases and for other diseases, but also a diagnosis causes stress. And that is something that happens every time. But as Andrew Bernstein said, stress never comes directly from your circumstances. It comes from your thoughts about the circumstances. And we know that there is a lot of evidence about mindfulness, about breathing, about psychological support, about psychological makeover in order to help patients with chronic diseases like Sjögren. It helps the mental and physical well-being of patients. But what is important? If you cannot do it alone, maybe you are doing mindfulness, maybe you are doing your breaths, but if it's not enough, talk to somebody and seek for professional advice. And look for supportive relationships. Supportive relationship is the fourth now pillar of lifestyle medicine. And I will tell you why. Because the kind of relationships in our 50s define the quality of our golden years. And this is a huge Harvard study of adult development. And what does it show? It still lasts more than, I think, 80 years. It started in the 30s. And according to the directors of that research, so what's the best thing to be happy in your 80s is have supportive relationships in your 50s. Sleep is another problem. That's why it's the fifth pillar of lifestyle medicine, because sleep could be a medicine, but if you have pain, if you suffer, if you have stress, then sleep is third. Seek for professional help, and look for professional help for sleep hygiene. So, what does it mean, sleep hygiene? I will tell you three things that are very important. Go to bed every night at the same time. Not every night, but most of the nights. Wake up the same time. Avoid screen time before bed. Keep your bed only for sleep and sex. Avoid drinking alcohol or having heavy meals before sleeping. Do some exercise, because exercise is a pill for everything, like sleep problems. Listen to some music, read a book, do some things, and also when you wake up, for the first minutes, look for the sun. Take care of your skin with sunscreen, but avoid screen before sleeping and look for the sun or any kind of something that looks like sun the first thing when you wake up. I think I don't have to say a lot of things about alcohol and tobacco, but I just want to say that it's not only the alcohol and the tobacco. When the screen time, when we are addicted to screen time, this is also something that we could minimize. When we are addicted to our work and we're alcoholics, this is not also good for our health and well-being. So, I think we know the power of lifestyle. Why we don't use it? Why we don't prescribe it in our everyday practice? I think you can read it. It says, I can operate. This is for another condition. I can operate, or you can go on a healthy diet. Yeah, better operate. Are you sure? My insurance doesn't cover a healthy diet. So I strongly believe that adopting these principles of lifestyle medicine can greatly improve the well-being and the quality of life of patients with Sjögren. Thank you very much.
Thank you very much, Mrs. Kaladzi. Do you have any questions? Yes or no? No? Okay, thank you very much.